that I'm here in Bellevue as a plastic surgeon in the Bellevue, Seattle area. We draw clients from all around, though, hours or even these states away, to be honest. I do plastic surgery. I'm dually trained in general surgery and plastic surgery, and I've been fellowship trained in the face. I do reconstructive work, but mainly in that facility, aesthetic work, and really anything from head to toe, men, women, anyone who kind of envisions something about themselves that they would like to optimize and need some help in getting to their goals on the surface of themselves. We can usually help with it.
Well, take us back. You mentioned being dual trained in general surgery and plastic surgery. Take us back to kind of what inspired you. Where'd your interest come from? How'd you get to where you're at in today's kind of practice?
Yeah, thanks for asking me that. Someone once told me in college, if looking back, someone were to write a book about your life, would you be interested in reading it? And my track was now in retrospect interesting, although my journey was, kind of one thing led to another. So I'm from a small town. I'm actually first generation college graduate, went to a pretty good school, jumped into healthcare through phlebotomy, which is drawing blood, and from there went on to become an EMT. And then I was a combat medic in the military and actually went on from the bevy of those experiences to say, you know what, maybe I should just be a pre-med. And then went to medical school, got some good training back in my home state of Iowa, went on to the Ivy Leagues in surgical training. And then from there, just got deeper and deeper into what I was kind of called to, I think, after starting in general surgery. I did a cleft mission in Guatemala with a really prominent plastic surgeon that just kind of took me away and saw transformational experiences in a couple of hours that would change children's lives for the rest of their lives. And I just had to be part of it. So trained more and more, did some subspecialty and fellowship training. And now I'm happy to say 10 years later after that experience, that same man that took me down there was recommending me for positions. I'm now an Operation Smile surgeon. I'm affiliated with multiple professional societies in my field, and really enjoy what I do because it is that fulfillment that I was looking for, which is giving people a transformational experience in a short amount of time that really helps them.
Wow, what a journey! Thank you for your service, by the way. I mean, I'm just in awe listening to this road that you went down. I mean, from phlebotomy, EMT, combat medic, dual trained in general surgery, plastic surgery. How many years in surgery is this training? I mean, general surgery is normally 5 years. I mean, tell us about that training. That is an intense training process.
Yeah, and thank you for saying all that. I mean, it's not been without a lot of help from my folks, a lot of help from my wife, a lot of help from mentors, one in which I, really credit that I work with in my area here is Dr. Gavin Dry. And basically what I would say to all that is, it was a learning process for me all along the way. I consider myself a lifelong learner and hope I am until the day I hang it up. And, that's just, I've kind of, each thing's been a stepping stone to the next thing. And I've enjoyed that ride, that journey. But how did it all happen? Following curiosities, following sort of a goal-oriented nature that I have. And I don't know if that's gotten to your question, but I guess that's what comes to mind for me.
Dr. Kristopher Day and Shannon O'Kelly return after this on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our conversation with Dr. Kristopher Day continues now on Northwest News Radio.
Dr. Day, again, thank you for joining us, Health Talk. Thank you for your background story. I find it fascinating. Let's talk about your practice. Give us the rundown there.
Well, the thing that makes plastic surgery really fun, other than that transformational experience and being able to be part of that for people that I mentioned, is just the variety. So I literally do surgery from head to toe. I'm fellowship and specially trained in the face. I do a lot of breast surgery. I do a lot of body recontouring surgeries for people that have lost weight, for people who want to recapture their body after childbirth. And, if they've been hitting it hard in the gym and dieting and it's just not gotten them all the way to their goals. I like to tell people I can virtually do any change that someone wants to do to their breast. The face is my area of subspecialization in my fellowship training, so I'm very comfortable around eyelid lift, facelift, neck procedures. And so that's probably what your listeners are most interested in, is kind of those things that they can electively reach out to us for. The other stuff, reconstruction, that is going to come our way through emergency departments and through hospital calls and things like that, that's going to find us no matter what, and I really enjoy it. And if it's as little as the complex laceration of a lip after somebody fell off their bike that I did last week, and now you can't even see where it was, and I'm, really happy about that, he's happy, then I love doing that work too. But for the elective practice that your listeners are probably interested in, we do it all.
And are you doing all these procedures predominantly outpatient? Is this done in a surgery center? You're home the same day?
Right, in almost all cases. Now, again, when I was in academic hospitals, even when I was based primarily in an inpatient facility, I would send most patients home. Probably 3/4 of patients that would come in for day of surgery procedures would go home. I like to use some approaches that enables that. One, I select patients appropriately that are healthy enough, and if they're not quite there yet, then we talk about things that they can do, maybe with their primary doctors or on their own, to do some modifications of lifestyle or something that will get them there. And then once the appropriate patient is coming to our ambulatory surgical center, then we have the confidence that we can deliver something and their bodies can handle it, and we try to prepare people for that too. I use multimodal pain medication, and I use a lot of block agents during surgery, so I'm trying to decrease pain. I'm trying to really shepherd people through their experience. I think that's very much the job and responsibility of the plastic surgeon and all the great people that I work with. We have consultants that, by the way, are very good at giving insights, and nurses that are very good at giving insights into the experience for people to expect, so that helps them prepare. I think if we do a good job of that, then almost all of our patients are recovering in the comfort of their own homes. And I don't know about you, but I've been in hospitals, and my couch is much more comfortable. The food is much better, So
yeah. Well, Dr. Day, listen, wow, what a journey. Your background is fascinating, and more importantly, your compassion and passion. But I want to have you come back maybe down the road. We can get a little bit deeper in the weeds and talk about some very specific procedures and outcomes. Thank you so much for your time.
Yeah, I'd love that. Thank you so much for having me. This was a wonderful experience.
Interesting to learn more from Kristopher Day, Dr. Kristopher Day.